cause of death around the world. One of the most common types of heart disease is a heart attack, which occurs when blood flow to the heart is blocked, usually by a blood clot. Knowing the warning signs of a heart attack can help you seek treatment quickly and potentially save your life. Here are 10 warning signs of a heart attack to be aware of. Sign number 1, chest pain or discomfort. Chest pain or discomfort is the most common and well-known symptom of a heart attack. It is typically described as a feeling of pressure, fullness, or tightness in the chest. Some people describe it as a squeezing or crushing sensation, while others describe it as a feeling of indigestion. The chest pain or discomfort may last for several minutes, or it may go away and come back. It is important to note that not all chest pain is a sign of a heart attack, but if you experience any type of chest pain or discomfort, it is important to seek medical attention immediately to determine the cause and receive appropriate treatment. Sign number 2, upper body pain. Upper body pain is another warning sign of a heart attack, and it often occurs in the arms, back, neck, jaw, or stomach. This type of pain is caused by the same blockage of blood flow to the heart that causes chest pain or discomfort. The nerves that supply these areas of the body are connected to the same spinal cord segments as the nerves that supply the heart. When the heart is deprived of oxygen and nutrients, the nerves send signals to the spinal cord, which can then be felt as pain or discomfort in other parts of the body. Upper body pain is more common in women than in men and can be mistaken for other conditions, such as arthritis or muscle strain. Sign number 3, shortness of breath. Feeling like you can't catch your breath can be really scary, especially if you haven't been doing anything that would normally cause shortness of breath. You may feel like you're gasping for air or like you just can't take a deep breath no matter how hard you try. This can happen because your heart isn't pumping enough blood to your lungs, which means your body isn't getting enough oxygen. Sign number 4, heartburn. Heartburn is a really common condition that most people have experienced at some point in their lives. It's caused by acid reflux, which is when stomach acid flows back up into your esophagus. While heartburn itself isn't usually a sign of a heart attack, sometimes a heart attack can cause symptoms that feel like heartburn. This can be confusing, because you may assume that you just need to take an antacid and wait for the symptoms to go away. However, if you're experiencing heartburn along with any of the other warning signs of a heart attack, it's a good idea to talk to your doctor. Sign number 5, swelling. Swelling in your legs, ankles, or feet can happen for a lot of reasons, including prolonged sitting or standing, a sedentary lifestyle, or certain medical conditions. However, it can also be a sign that your heart isn't working properly. When your heart isn't pumping blood as effectively as it should be, fluid can build up in your tissues, which can cause swelling. This can be a warning sign of a heart attack, especially if it's accompanied by any of the other warning signs we've talked about. Sign number 6, irregular heartbeat. Your heart normally beats in a regular, steady rhythm. However, if you're experiencing an irregular heartbeat, also known as an arrhythmia, it could be a sign that something's not quite right. Some people describe an irregular heartbeat as feeling like their heart is fluttering or skipping beats. You may feel like your heart is racing or pounding in your chest, or like it's beating too slowly. If you're experiencing an irregular heartbeat, it's important to pay attention to any other symptoms you may be having. Sign number 7, cold sweat. If you're experiencing cold sweats, it means that your body is producing sweat in response to something. This can happen for a lot of reasons, including stress, anxiety, or a sudden drop in blood sugar. In the case of a heart attack, cold sweats can happen because your body is under stress and trying to cool down. Cold sweats can feel different for everyone. Some people describe them as feeling clammy or sticky, while others may feel like they're suddenly freezing cold even if the room temperature hasn't changed. Sign number 8, nausea or vomiting. Feeling nauseous or vomiting can happen for a lot of reasons, including a stomach bug or food poisoning. However, it can also be a sign that something's not quite right with your heart. When your heart isn't getting enough blood or oxygen, it can cause a lot of different symptoms, including nausea and vomiting. These symptoms can be especially concerning if they're accompanied by other warning signs of a heart attack, like chest pain or shortness of breath. Sign number 9, lightheadedness. Do you ever feel like you're about to faint or lose your balance? That sensation is called lightheadedness, and it can be a sign that something's not right with your body. While it could be caused by a range of issues, it's important to be aware that lightheadedness can also be a warning sign of a heart attack. If you're feeling lightheaded or dizzy, it's important to take a moment to sit down and rest. If your symptoms persist or are accompanied by other signs like chest pain or shortness of breath, don't hesitate to seek medical attention. Sign number 10, fatigue. Fatigue is a common feeling that many of us experience after a long day or week. However, if you're feeling excessively tired or run down even when you've gotten enough sleep, it could be a warning sign of a heart attack. When your heart isn't functioning properly, it can cause your body to feel fatigued or weak. This can be especially concerning if you're experiencing other warning signs of a heart attack, like chest pain or shortness of breath. If you're feeling fatigued or unusually tired, it's important to take some time to rest and recharge. If the fatigue persists or is accompanied by other symptoms, don't hesitate to seek medical attention. It is important to note that not everyone experiences all of these symptoms during a heart attack.